this is Dr. Janson, and today I'd like to talk to you about gout. I did see a couple of patients this week with gout, and gout is a seasonal problem that as the weather starts to get a little bit warmer, you're going to start seeing patients with gout in the podiatry practice. So let's talk about gout today. It's a form of arthritis, and people know it as being in your big toe joint. That's the most common place for gout to show up. I have seen it in the elbow, I've seen it in the wrist, but usually it's in the big toe joint. And what it is crystals that are normally in your bloodstream, and these are called urate crystals, there's so many crystals in your bloodstream that they start coming out of solution, and they'll start to crystallize or turn from something that's liquid into a solid. So solid crystals start to collect in the big toe joint. So you could imagine that would be very painful. So why are these crystals, why are there so many crystals, and why are they collecting in the big toe joint? And the answer is that the crystals are a byproduct of protein metabolism, particularly purines, which is a type of protein. Your body breaks them down and it forms the byproduct of uric acid. And then this is put into your bloodstream, and then your kidneys excrete the crystals out into your urine, and that's how you get rid of them. So you could be eating too many purines is one way to have too many crystals. Purines are in red meat, alcohol. They used to call it the rich man's disease. You can imagine, somebody having a big piece of meat, or a big roast beef, and a big glass of beer would be the typical diet for somebody with gout. Benjamin Franklin is someone who was famous who had gout. They were, carrying him to the Constitutional Convention. And he was like a heavyset guy, and you can just imagine him going home afterwards having a big beer. Too many purines in your diet, or your kidneys are not working properly. They're not eliminating the crystals, so you're under excreting the uric acid. And examples of conditions that would cause that would be high blood pressure, diabetes. Being overweight will decrease your kidney function. And heart disease will also decrease your kidney function because your heart is not pushing as much blood into your kidneys, so they don't push the crystals out into the urine as well if you have heart disease. So those are some of the risk factors for gout. It's extremely painful. I worked in the hospital as a resident, and we would get called down to the emergency room, and the patient would say, I think I broke my foot. I'm in horrible pain. I feel like somebody took a baseball bat to my foot. They were really in trouble. So much pain that they would go to the emergency room, if you could imagine that. That's how painful gout can be. It's usually in the big toe, like I said. The toe is red, very red, swollen. You might see the whole foot swollen. Not just the big toe. You'll see the whole foot swollen, red, very painful. You could go, if you have an acute gout attack, you can go to the emergency room. But normally you'd have, come on slowly. You would call your regular doctor, and the doctor would have you come in, and they would take a blood test, of course, to test for the uric acid. But here's something interesting to think about. If all the crystals have now gotten out of solution and went to your foot, your blood levels might be normal or low for uric acid. So in an acute attack, you might not see high uric acid levels in the blood. So anything over 7.8, I would say, like getting closer to 8 or over 7 for uric acid is considered gout. But many times I'll see an acute patient and their uric acid levels will be 4 or 5 milligrams, which is on the low side, because all the crystals are not in the bloodstream, they're in the foot. Another way to look for gout is to take an x-ray, and if the patient has had 2, 3, 4 episodes of gout, you'll start to see changes on the x-ray, because the gout creates this very swollen red joint, and the blood will actually start washing away the bone. So you'll see these little punctate holes in the head of the metatarsal where the gout is, and that's evidence of multiple occurrences of gout. So the doctor might take an x-ray. Another treatment for gout, especially in podiatry, if you see a podiatrist for this, they're going to give you a cortisone injection. That's a blessed relief. A cortisone injection to a gouty toe. It works very quickly. Within a few hours, you'll feel much, much better if you have a cortisone shot. And then the doctor may also give you a prescription for an anti-inflammatory drug. There's indomethacin, which is a very strong anti-inflammatory. Meloxicam is another one. They may give you, if your gout is very acute, you might get a prescription for colchicine, is another drug. And then if you have repetitive episodes of gout, they're going to give you a drug called allopurinol. And that whole classification of drugs will make you excrete uric acid better. So you get rid of it right out of your kidneys. That drug is called allopurinol. If you're given a prescription for allopurinol, actually in the beginning, it can make your gout worse because the crystals can come out of solution and go into your foot when you first get a prescription of allopurinol. So I sometimes see that, an acute case of gout when a patient is put on allopurinol. Now I was telling you that you could, if you eat too many purines, you can increase your risk of gout. So let's talk about diet really quick. What's the diet for gout? So you want to decrease the red meat, I already told you. Another source of purines is canned fish, like anchovies, sardines, tuna, that kind of fish. Try to avoid that. Avoid shellfish. Shrimp is notoriously bad for gout. Some vegetables are said to be bad for gout. I haven't really seen that to be true. I did have a patient once who only ate spinach shakes and got gout from it. But he was eating 10 boxes of frozen spinach a day. But otherwise, I've never seen the asparagus or spinach cause gout. I've never actually seen that. Avoid alcohol. Alcohol is probably one of the worst things, especially beer. Beer is really bad. Coffee is a question because if coffee is a diuretic and it's difficult for your kidneys, people think that might cause gout. But I've actually seen that coffee is not so bad. So 1 or 2 cups of coffee should be fine. Otherwise, drink herbal tea. Another bad food is anything with fructose in it, because fructose is broken down into uric acid. So fructose is in tons of baked goods, candy, juice. Don't drink any kind of juice. Juice is, orange juice is pure fructose. So if you want to have gout, just drink a big glass of orange juice. That'll give you a nice case of gout. So avoid juice, candy, baked goods. Really breads, don't eat breads. And I would stay away from starchy foods too. They're a little difficult for the kidney to process. So what's an example of good foods? Now I just told you canned fish is bad, but fresh fish is very good. So salmon, flounder, tilapia, any of those fresh fish are fine. Chicken, turkey. Try not to eat the skin of the chicken because the fat is a little bit of a problem. Remember I told you that obesity or weight gain slows your kidney function, so you want to kind of avoid the high calorie fat. So lower fat, like yogurt is good, low fat yogurt. The best food on the planet, if you have gout, is eggs. Eggs have no purine in them at all, no purine. So if you just ate 2 hard-boiled eggs, 3 times a day, if you have gout, you will not have gout in a week because eggs have no purine in them whatsoever. So egg is a very good food. And you can soak your foot in warm water 3 times a day with Epsom salts. Not boiling hot, but warm water. And I know that's very counterintuitive. Sorry for the sirens. Midtown hat. It's counterintuitive to have a big red swollen joint and you think you need ice, but actually you need to put heat on it. Because remember, I told you that the crystals are coming out of solution because of the low temperature of your foot. So heat helps the gout crystals go back into solution. So heat is helpful. Rest your foot. And of course go to the doctor. I do have patients, I say, how long have you had this? And they, I've had this for 3 or 4 months. 3 or 4 months, these crystals are no good in your foot. They're not only in your foot, they're in your kidneys too. So, you know, and these are the same crystals that are kidney stones. So don't ignore gout. You should go to the doctor and, you know, have the doctor check it out and keep track of your uric acid levels, you know, and do treat gout. So I hope that this video was helpful if you have gout, and good luck with this, and like and subscribe, and thank you for watching.